Good afternoon.
Good afternoon, Madam Chair.
Happy Sinai Die. You are in the Finance Committee. Today is Monday, April 13th, and we are going to start with Amber.
Okay, I have a number of concurrences and one bill to vote. Which one would you like to do first, Madam Chair? The concurrences? Thank you, Nathan.
Only concurrences straight through, then we'll switch to bill.
Okay. The first on the top of the blue sheet that you should have for the concurrences, Senate Bill 233. Senate Bill 233 in general prohibits a registered cemetery and permit holder or an exempt cemetery owner from selling or transferring a cemetery in whole or in part to another person without the approval of the Office of Cemetery Oversight. The House amendments strike the bill and replace it with a combination of two House bills, namely House Bill 892 and House Bill 893. A motion not to concur would be appropriate, and the House has named conferees if the Senate would like to do the same.
So, can I comment? Senator Jackson and Senator Reedy, would you join me as conferees? Thank you.
It'd be my honor, Madam Chair.
Not concur.
Correct. A motion not concur would be appropriate.
Do we need to vote? We need to vote.
Yes.
Okay. We have a motion not to concur.
Second.
Second, everybody in favor of not concurring? Thank you.
Mike,
Unanimous, Tammy. Whatever that number is. 1, 2, 3, 4, 6, 7, 8, 9. 2, 3, 3. I already let the chair know.
Okay. The next on the list is Senate Bill 389. This is the Transit-Oriented Development Bill. It's an administration bill that makes several changes to the state law related to transit-oriented development. The House amendments primarily reinstate a scoring preference for the use of project labor agreements that was struck by the Senate in both the House and Senate versions. If the Senate would like to proceed in its position to have the project labor agreement struck from the bill, a motion not to concur would be appropriate. The House has not appointed conferees, but the Senate would be able to go ahead and appoint conferees if it would like to.
It's the project labor agreement amendment. Not concur. Can we get it done?
I would go ahead and appoint conferees with this not concur to make sure it moves through the process.
So we do a motion not to concur, right?
Correct.
All in favor of the not to concur in Senate Bill 389? It's a unanimous vote, thank you. And now we need conferees. Senator Hayes?
I'll go with Dan Henry.
Who else?
Hershey.
Senator Hayes, Senator Hershey, and is there another
Put me on.
senator? Okay. Okay, my next concurrence on the list is down at Senate Bill 893. This is our favorite penny rounding bill. The House amendments to this bill are technical and conforming, and they are identical to what we did in the House bill as we sent it back. I would, a motion to concur would be appropriate.
Okay, Senator Gall, motion to concur. Can I have a second?
Second.
Anything to get it back on the
Senator Hershey
floor.
seconds
Anything to
that.
get it back on the floor again.
All in favor of the concurrence?
Everybody can talk about that.
All in favor of the concurrence? Unanimous vote, thank you.
Anyone can talk about that one.
No, you're not.
We've gone to 10, Tammy, Senator Kramer.
That's 10:30 PM bill.
We just voted concur.
Concur on
Oh, yeah.
893.
Okay.
All right, and then the final three bills about reseeding are also mine, so we're going to work through those. House Bill 141, it's the collective bargaining for graduate assistants. The Senate amendments conformed the House bill to the Senate bill, and those Senate amendments limited the application of the bill to 2 university campuses and delayed the effective date of the bill by 2 years until July 1, 2028. The House has appointed conferees. a motion not to recede would be appropriate, and the Senate may also appoint conferees if it chooses to.
Move not to receive.
Second. Okay, all in favor of not receding on House Bill 141? Okay, who would like to be conferees?
Brady.
Senator Kramer?
I'm happy
I
to,
will be.
I'm happy to join my friend Kramer.
Okay, so Senator Kramer, Senator Lamb, and Senator Hershey.
I don't want Hershey.
He knows we made the bill better.
Yes, we did.
Okay,
I will,
I don't want
much
Hershey.
as I don't like the bill, I will stick with my Senate teammates. You know that part.
I want Senator Guile.
Remember the rule, you have to have one of those pesky old Republicans on it.
Why, they're not putting any minorities on the House side.
We're not the House.
That's right. I
So-
want Senator Guile.
House Bill 339, is that yours?
Yes, House Bill 339 modifies the pay schedule of the full-time chief inspector employed by the Anne Arundel County Board of License Commissioners. The Senate amendments conform the House bill to the Senate bill. There have been conversations with the House delegation, so a motion not to recede would be appropriate and ask that the House reconsider its position.
Okay. Senator Gao says yes. Tom, a second? Senator Washington, second. Okay.
We not receive.
We're not receding. Should we appoint?
We do not need to appoint conferees. It is my understanding the House will be accepting the Senate amendments. They have moved the Senate bill
Okay.
in this same posture.
All right, that's where I thought I was confused.
Okay.
Okay.
And then the last bill on the concurrence list is House Bill 892, which is the cross-file to Senate Bill 233. The Senate amendments conformed the House bill to the Senate bill. A motion not to recede to put this bill in the same posture as Senate Bill 233, and appointing conferees would be appropriate.
Okay. So should
And-
we have the same conferees as we did for 233?
That would make the most sense, yes.
Okay. So that's Senator Jackson, Senator Reedy, and the chair.
That is correct.
I already have a message they want to meet. Okay. Thank you, Amber.
And that is the end of my concurrences. We can move to Lisa's.
Okay. Yeah, I have Senate Bill 626 is back for concurrence from the House. It requires the Secretary of Health to issue a new birth certificate to reflect a sex designation different from the original birth certificate. And the House amendments remove the provision of the bill requiring the Secretary to keep a birth information history for each individual issued a birth certificate of birth in the state.
Move to not concur. Side conference meeting.
All in favor of the not to concur?
When we sign a conference meeting.
You want to sign a conference meeting? So Senator Lamb, obviously you want to be in the conference committee. Who would like to be the Senator Lamb in this conference committee? Who else besides Senator Lamb?
Alonzo and Reedy.
Senator Washington, did you volunteer? Okay. All right, we got it. He did really good on the floor today. He did a great job.
Yeah, it was good.
Fought off those pesky Republicans.
Okay.
So Senator Lamb, Senator Washington, and Senator Reedy, was that?
They got one.
Did you want to bring up the concurrence for 866 or no? No?
Switching to me then?
Yes.
All right. Next, for the committee, this is Senate Bill 742 is back from the House. Senate Bill 742 establishes additional requirements for waivers administered by the Developmental Disabilities Administration and codifies existing federal mandates related to those waivers. The House added a technical amendment to ensure compliance with federal law. The Senate bill sponsors support the amendment, and the Department of Health advises that the amendments removes their concerns about the cost, so a motion to concur would be appropriate.
I move we concur.
Second.
Second. All in favor of concurrence on 742? Thank you. Okay.
All right, now on to the voting list.
What happened to,
What happened to 866?
Lisa was asking if you wanted that to be brought up, and we thought you said no.
okay. Okay. Well, sure, we talked about not concurring though with the Senate. Okay.
6 requires each chain restaurant to display on each menu or menu board a written disclosure and notice to customers that standard menu items may contain high sodium or high sugar, and full nutritional information is available through a QR code online or by request. The House amendments require a chain restaurant to display a warning icon next to each menu item exceeding a certain amount of sodium or added sugar.
The Senate amendment said,
The Senate amendments just left the part about the QR code and when you scan that to get the
okay.
nutritional information.
So, motion not to concur, Senator Washington. Do I have a second for not to concur? Senator Jackson? Okay. I feel like we did too, that's why.
We didn't, we moved,
This part already. We're supposed to appoint committees, conference committee members.
Conference committee?
yeah.
Okay, that's next, yeah.
But we already did that part
I think we,
of not concurring.
We asked the House to recede the first time, and then this is back for concurrence. We didn't appoint conferees the last time we had this for concurrence.
What I know, Madam Chair, is that they're working on a compromise.
okay, so, would you like to be on the conference committee?
Yes.
Okay, who would like to be with Senator Washington on the conference committee about menus? Senator Mounts, I need one more Dem.
Sure.
Senator Lamb, okay, thank you. Thank you, Senator Washington. Okay. Got lots of conference committees, it's gonna be a busy afternoon. Okay, what's next?
All right, I think I'll do the one bill that I have on the pink voting list. So this is House Bill 598, and as amended, it repeals existing provisions exempting individuals from certain education requirements for a physician license. Instead, the bill authorizes the Board of Physicians beginning October 1st of 2028 to issue a limited license to practice medicine to a physician licensed in a foreign country who meets the requirements specified in the bill. The term of the limited license may not exceed 3 years, and a limited license may not be renewed. The bill outlines requirements for a limited license, specify how the board may determine an applicant to be ineligible or how to revoke a limited license, and then provides a pathway to full licensure for limited licensees. The amendments make a number of technical changes and generally align the bill with Senate Bill 489, which passed the Senate unanimously earlier this session, and then implements the bill as described. My understanding is that the Board of Physicians is fine with the bill with these amendments that are offered by Senator Lamb.
I haven't actually seen the amendments, but you're okay, because I'm also getting a message from the House sponsor, and I can't decipher it right now. Okay, so Senator.
Yes, I
Senator
think
Lamb.
this is the version that came out of the Senate, including a provision at the end to allow these folks to be able to get a full license. It is also the version that has a consensus of all the stakeholders, including the Board of Physicians. They're not opposed to this. So this, I think, aligns with your perspective on this.
So we have a motion from Senator Lamb. Can I have a second? Senator Guile? All in favor of House Bill 598 with amendments? Should we do a roll call? We're okay. Everybody okay? Unanimous vote, Tammy.
Okay, for me, the first one I have is Senate Bill 1002, which establishes a Class AER equity retail beer, wine, and liquor license in Prince George's County and authorizes the Prince George's County Board of License Commissioners to issue the license only to an applicant that is certified by the county The license authorizes the license holder to sell beer, wine, and liquor at retail in sealed packages or in containers for off-premises consumption. The board may issue up to 2 licenses per year. There are 2 amendments. Amendment 1 is technical, and Amendment 2 sets certain criteria for the issuance of the Class AER license, provides criteria for the board to determine priority amongst license applicants, and requires the board to submit an annual report on the issuance of the licenses. There's no fiscal impact and was no opposition at the committee hearing.
Thanks, Senator. Do I have a second? Senator Rao, all in favor of this local Prince George's County bill, Senate Bill 1002? Unanimous vote.
Next is House Bill 494, which requires an individual, group, or blanket health insurance policy or contract delivered or issued for delivery in the state by insurers, nonprofit health service plans, and health maintenance organizations to provide reimbursement for healthcare providers in a manner that meets the annual primary care investment targets established by the state. The bill further requires the carrier to submit a description of the carrier's progress in meeting the annual primary care investment targets when filing a premium rate or premium rate change with the insurance commissioner. There are no amendments.
Senator Rao, is there a second? Senator Washington, all in favor of House Bill 494? Unanimous vote. Thank you. House Bill 1223.
House Bill 1223 establishes a Prince George's County work group on farmers markets and street vending zones. The work group must identify and review any current regulations or permitting for farmers markets and street vending, examine how other counties regulate or permit farmers market and street vendors, identify any safety, health, or environmental concerns related to farmers markets and street vendors, identify any community concerns about farmers markets and street vendors, and make recommendations on establishing a framework and regulation and permitting of farmers markets and street vendors. There are no amendments, no fiscal impact, and no opposition at the committee hearing.
Senator Washington, you want to move favorable? Sure. Thank you. Do I have a second? Senator Rao? Yes. Oh, Senator Rao. Yes, you can say something.
The delegation, that farmer's market in Baltimore City is a big deal. And if we get an organized one in Prince George's, I hope there's some coordination. So for the people that go supply them are able to participate in both of them.
I think this is the study, though, isn't it?
Yes.
This is the study, so.
I'm happy to second that. yeah,
Okay.
yeah.
Okay, so all in favor of House Bill 1223, local bill? Yep. Unanimous vote, thank you. I think we're to 11 now, and we got to 11. Okay, one more bill that we just added, House Bill 1117, still good.
House Bill 1117 authorizes the Virginia Jones Alzheimer's Disease and Related Dementias Council to recommend the use of elopement response devices as safety tools for individuals who are at risk of elopement because of Alzheimer's disease and related dementia. The advisory stakeholder group on autism-related needs is similarly authorized to recommend the use of elopement devices as safety tools for individuals who are at risk of elopement because of autism. There are 2 amendments. Amendment 1 is technical, and Amendment 2 changes the entity making recommendations for elopement response devices for individuals with autism from the advisory stakeholder group on autism-related needs to the state coordinator for autism strategy.
But this is Alzheimer's.
There's both parts. So part of it is recommending elopement. The Alzheimer's Council's recommending elopement devices for people with Alzheimer's and dementia, and then either the autism stakeholder group or the state autism coordinators making recommendations for people with autism.
Just run them around. Can I have a motion favorable on House Bill 1117?
Move favorable.
Senator Rao, Senator Lee, all in favor of 1117? Unanimous vote. And then Amber has one, House Bill 797.
House Bill 797 is identical to Senate Bill 439, which the Senate passed earlier this session. The bill prohibits an employer of a fire and rescue public safety employee on the basis of the employee's possession of a valid written certification for medical cannabis or a positive test for cannabis components or metabolites while holding a valid written certificate from disciplining, discharging, or otherwise discriminating against the employee with respect to the employee's compensation terms, conditions, or privileges of employment, or limiting, segregating, or classifying its employees in any way that would deprive or tend to deprive the employee of an employment opportunity or otherwise adversely affect the employee's status as an employee. There are no amendments to the bill.
We have a motion and a second on House Bill 797. All in favor? Unanimous vote. Thank you. Oh, you're opposed. I'm sorry, 10-1. Thank you.
No, I mean, technically, it should be a hearing.
Let's hear from, what are the differences? And we're back to,
Well,
What do you want?
it just came out of rules, so technically, a House bill should have a hearing.
we passed the Senate bill. This is just for the differences.
This is the brand new, this is just their bill.
This is the House bill that just came over.
Is it a crossway?
It wasn't on the voting list, House Bill 299, which is the cross-file of Senate Bill 60.
No, Senator Jackson's bill, right?
It was a departmental bill from
Departmental
the
bill.
Department of
We
Labor.
moved past that.
Yeah,
Normally,
we're done that. We voted that. We're on the Rules Committee just passed 15 bills out of rules. And most of them are cross files to Senate bills. So they were holding the House bill until the Senate bills passed. And now the Senate bills have passed. So the particular one that Senator Hershey's asking about is House Bill 299, which is the cross of Senate Bill 60, which we had on the floor today, second reader. And it's the wage bill that we put amendments on.
got it.
So their bill's not in the same shape, they're not in the same,
No, we had additional amendments we put on from the contractors.
yeah.
We don't need to move it. I mean, there's the Senate bill's out there.
Do we take a vote whether to move these or not?
Well,
They all came out of rules.
I mean, there's more than one, I don't know how many of these bills
That came out of rules are in this committee. But that's what I'm saying. Technically, they would get out of rules and you would have a hearing on them.
It's the only one. Oh, no, there's another one.
Yeah.
There's two that came to finance. We were lucky.
I know. Well, we've done a good job in Rules Committee.
It's now on third reader in the Senate with our amendments. So if we let this out of rules, we would conform it to the Senate bill. So I don't see a problem with doing that. Lisa, Nathan, anybody comment?
Finance generally does not hold hearings on cross-filed bills.
Right.
And particularly if your plan is to amend the House bill to conform to this bill that passed out of the Senate bill, I don't think you need to have a hearing.
Okay. So I would just say, we've got two of these bills, exactly what Nathan just described. We already passed the Senate bill, and we normally would not have a hearing. I'd like a motion for us to pass House Bill 299, conforming to the Senate bill. Do I say that?
Yes.
And then I believe House Bill 1445 is in the same posture.
And what's that bill?
That is the Maryland Medical Assistance Program and Developmental Disabilities Administration and Community-Based Services Eligibility. Was this Senator Gazzoni's bill?
This is the cross-file to the bill that you just voted to concur in the House amendments. So I have not reviewed it, but assuming that the two bills passed out of the House are aligned, you can vote favorably on House Bill 1445
Okay.
with no amendments.
All right, so first I need a vote on House Bill 299, favorable with the Senate amendments. Can I have that motion? Senator Jackson, can I have a second? Come on. Second. Senator Washington, thank you. I can see you'd like to say something, Senator Hershey. No, you turned your light off? Okay. All in favor of House Bill 299 conform to the Senate Bill 60? Okay. Let's do a roll call.
House Bill 299 is favorable with amendment. 299.
They're gonna make them like the Senate bill.
Yes.
I'm sorry, Tammy's calling the roll.
So is it favorable with amendment?
Yes.
Okay. House Bill 299, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer? Yes. Senator Reedy?
It's a no for me.
No. Senator Ellis? Abstain. Senator Mounts?
No.
No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile?
Yes.
Yes. Senator Lamb? Yes. Senator Hershey? No. Madam Chair?
Yes.
Yes. 7, yep.
Okay. Thank you. Senator Kramer and Senator Reedy, all in favor of 1445? Unanimous vote, thank you. All right, and then I think that's all we had. Okay. Nothing else? 3:15, accept my conference committee on cemeteries. They would like to meet. Can we, do you think we could do, we won't go right at 3:15. Can we do 3:10 in the Silver Room? Is that okay, Senator Jackson? 3:10 in the Silver Room? Thank you.